Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will take our talk would be about communication station 4 cases of the communicable diseases. First, there are 3 or 4 scenarios that are present in the exam. The first one would be about HIV, susceptibility to HIV infection. If someone pay money for sex or needle stick injury, and the needle stick injury is the most common case with a nurse that has a needle stick injury during dealing with the patient, and she is angry actually. The second case is patient found to be HIV positive, to be told the results, and this will be a case of breaking bad news, and patient incidentally discovered that he has HIV while he was doing the routine lab test for hemodialysis. Other communicable diseases, HCV and HPV. Cases like needle stick injury in a pregnant lady, and patient pay for sex. The fourth one would be tuberculosis, TB, and the most common case that present is incompliance with the medication. In these cases or this situation, do not ever ask the patient if he wants someone to attend the meeting or not. So you would breach his confidentiality. So never breach patient confidentiality. How to take care of your patient and to talk with the patient with complete eye contact and show empathy to the patient and never judge him. How to break bad news, know the difference between HIV and AIDS, how or who may notified by his disease, when to trace contacts is needed, what are the precautions to be done in each separate case. Like every communication case, the same structure you follow. First, introduce yourself. Hello or good morning, I am Dr. Salama. I am here today to discuss your condition. May I confirm you are Mr. Samir, 37 years old? Yes, I am, doctor. Mr. Samir, would you tell me how much do you know about your condition? Blah 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 blah. May I ask you how do you feel today? I am okay, doctor. So, may I ask you, do you have any expectations? Do you have any expectations about your disease? No, doctor, I don't have. I'm really sorry, it's a breaking bad news. I'm really sorry, but I have a bad news for you, the warning shot. Then do not hesitate, run away from the discussion or from the question. What I have, doctor? What's the problems that I have, doctor? Then you have to counsel him about the problem that he have. If a case of HIV, discuss the normal variant first in a clear, easy words, then the abnormal. The human immune system or the defense system in our body is a system that is responsible for defending against abnormal bugs and viruses that invade our body. In your situation, you caught a virus, which is called HIV, which may disturb this system and causing your immunity to be more weaker, causing some problems. He may ask you, do you mean I have AIDS, doctor? No, you just have the virus in your blood, but you don't have the complication of the disease in your body, so you're still HIV positive, you don't have AIDS yet. So what are the symptoms and signs, or what is the clinical picture for this? You may be susceptible to be invaded by abnormal bugs or the normal bacteria or viruses that may be present on our skin may invade your body easily and causing severe health problem, which may require some aggressive treatments. And Actually, the complication, you have to tell him the complication of the disease itself. You might have a cancer called Kaposi cancer. It might have some abnormal bugs that may invade the brain or may invade other organs in your body. So we have to initiate the treatment as early as possible. Then complete your structure and take the history part from the patient. The first thing, with whom you are living with. Are you married or not? Does she have or does he have any problem or not? Taking the sexual history of the patient. Do you have a safe, intimate relationship? Do you have extramarital intimate relationship? You are not here to judge the patient habits, or you judging your patient. You are here not to blame him that he has the disease. You are here to help him. So never blame the patient. Then ask him about his job, about smoking, about alcohol, about driving, and also about drug history. Does he take any illicit drugs? Does he share needles to exclude or to make the precautions, or to tell him the precaution according to the situation? And ask him about his past medical history and his family history. What are the precautions you may tell the patient who has HIV? Avoid sharing needles and others. Avoid donating bloods. Practice safe, intimate relationship. And for the nurse who has a needle stick injury, she might not be in place in which they dealing with open wounds. The concern you have to ask the patient may ask you what is your concern, and there are different concerns in those cases according to each situation you are facing. The patient is HIV positive and he don't want to tell his wife. It's one of his concerns. The second concern, the patient may have HIV positive results and don't want to receive the treatment. Patient is a nurse, and knowing that the patient that she had a needle stick injury from had susceptible to be HIV, and want to breach his confidentiality and make HIV test for him. The patient who has tuberculosis doesn't take the medication because a problem in the medication itself, or a problem in his psychology, or a problem in the staff who's dealing with the patient, or his job. A lot of concern is in these 6 scenarios. You have to know how to answer for each one. The management plan. You would say, I would do some blood investigation. We may need to do some scan according to the problems that he has right now, and the treatment. This is a clinical judgment that you would be remarked for. So you have to tell him that you will admit him or not. You will do some blood investigation. You may do some scanning, and the treatment. You may also repeat the precaution to be taken, and he will be under a multidisciplinary team. Which consists of the infectious doctor and you and his GP. One of the concerns is the patient has a problem with his GP and don't want his GP to be notified by his disease. So what you have to do in this situation? And also occupational therapist and social worker if needed. Then after you finish the concern and answering the concern probably and non-medical terms, then tell the patient, would you please recap for me, or would you tell me the message you will take you with whom today, and recap the patient and ask him for any concern. After that you have to finalize your case and give him, I will give you now my hospital contact number. I will make another appointment or another meeting to discuss further about the situation, or what is a concern that may need another appointment. You would give him a leaflet and brochures and websites to know more about his disease. and then thank patient and finalize your case. In cases of TB and meningitis, you have to tell the patient that you must know if someone have this problem, other one has these problems at home or at school or at the job, to make a trace contact for people who might have the disease, the meningitis or the tuberculosis. Also, in cases of TB, you may ask the patient if he has any contact with a diseased, any recent contact with a diseased people, like one who live in hostel and has this disease from there. That's all for communicable diseases, except for HPV. In case of pregnant woman, what will you do with her? And I wish you have been informed with some of the communicable diseases that present in the case scenarios in mrcp basis exam. Thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.